mean, we hope that you guys like all the presentations so far. The next session is going to be presented by Amber Jordan. She's coming actually from out of state. And this session, this portion of the AACHCC Symposium is being sponsored by Think Times. And we met Think Times, and while they were providing a demo for one of the health centers here, all of you might know that we have been, from the AACCCVN, have been, promoting the use of the business intelligence, Power BI, and, how can we integrate the data? How can we improve workflows? And when we met with John over there in one of the demos, I was just fascinated with, how the workflow and the waiting time can be reduced, but also while utilizing data in the business intelligence portion. So thank you, John, for sponsoring this. And then, Amber will take it over and she can tell you all about it.
All right, thank you. Can everybody hear me okay? In the back? Yeah, thank you. I just giggled to myself a little bit earlier when the slide was up with the map of Arizona and I saw Yuma down in the bottom left corner. When I was in high school, I loved to shop at thrift stores, and I found this really cute blue t-shirt that said, "Somebody in Yuma loves me." And I didn't know anybody in Yuma, so I thought it would be a really good conversation piece. So people would ask me, "Oh, who do you know in Yuma?" And I'd say, "No one." And they said, "But your shirt says somebody in Yuma loves you." And I said, "Well, yeah, I'm fun. Surely somebody does." So just a good, I hadn't thought about that shirt in a long time, so. Of course, it's going to have me log back in. Yeah, my name's AJ. Well, my name is Amber. That's the name my mama gave me, but I go by AJ at work, shorter for people to remember. And I want to take you just on a journey today, a journey that we've been on as a health center and some problems that we've figured out how to solve that I think are common to all health centers. We're pretty small, 3 clinics. We serve about 9,000 patients. But we're known for being very innovative and doing things that larger health centers might do if they had a little, if they're financially stable. But we take big risks and we get big results. And so I just wanted to share some of those things with you today. And I'd like to start with a story. See if I can operate 2 devices at a time here. Here's a picture of one of our exam rooms in our clinic. And about 3 years ago, we started on a lean transformation journey with a company called Simpler Consulting, and they're now owned by IBM. Because we recognized that we'd picked a lot of low-hanging fruit and improvement, but we're still having real challenges. So we're starting to do this work. We were seeing some really impressive results. And so I took our board quality committee one day on a walkthrough in the clinic just to say, "Hey, look at all this cool stuff we're doing." And I walked them through that door, which is where the dental team is behind that door. And we got to this exam room and we stopped and paused at a huddle board. And as I'm talking with the board, a patient opens the door and says, "I've been here for 25 minutes. Is anybody coming back? The doctor, the MA?" Just like, are you kidding me right now? So super embarrassing. What was really bothersome is that I was walking through the clinic by myself a week later and the same thing happened. And so I just thought, wow, this is really an issue. 2 times in 2 weeks, I'm doing kind of a walkthrough and have the same issue. So it wasn't anybody's fault. We try to be really hard on the process and easy on the people. But we've designed workplaces and clinics where everything happens behind closed doors. And in our clinic, it's U-shaped. So you can't see all the exam rooms line of sight. So nobody knew what was going on with the patient. The patient didn't know what was going on with their visit. And so we have these clinics and we've sometimes unintentionally designed these environments where people don't have good situational awareness. They don't know what's going on with patients. They can't find the resources they need. And so it creates this workplace that can be a little bit chaotic. People spend a lot of time searching. It becomes very tiresome. And it's just not great for the patient experience either. So this is a time in the world when we really need workplaces that are calm and productive and people are connected with their sense of purpose, not running around searching for resources, working in a chaotic environment when the rest of the world is already so chaotic on the outside. So Today, I'm going to talk you through about some of these problems, like this one that we've struggled with, and what we've done to try to create a sense of flow and predictability and really high quality, repeatable patient visits. So we had 4 major barriers that we found to really having exceptional patient and care team experiences. So patient visits and a really great workplace. First one is we had a flagging system, like many of you do, probably, but nobody used it in a standard way. So some people were using some colors, some people were flagging for some things. It was just impossible to know what was happening in the clinic. And as I mentioned, we have a U-shaped clinic, so if you couldn't see the flags from where you were sitting, you had no idea if you were needed, if a patient was ready. So just really challenging use of this flagging system because we just didn't have standards. So, and we also didn't know if patients were waiting in that room for us. So there's literally no way to see what was happening behind that door, which is very challenging. The second one is we really were trying to focus on cycle times in our improvement work, but we didn't have good cycle time data. We knew kind of this toes in, toes out number, but we had no idea if a patient was in the clinic for 120 minutes, which is not standard for us, why were they in the clinic that long? Did a visit turn into a procedure, or did they need behavioral health integration? Did they see the dietitian during their visit? So we just didn't have real good transparency into our visits. The other thing was, if patients blew by our checkout desk, we had no idea they were gone. So at the end of the day, we clicked the checkout button and it looks like the patient was in the clinic for 6 hours. Well, that's really challenging to work with when you're trying to get cycle times and figure out how long is the patient visit supposed to be? And when it's not the length it's supposed to be, what happened? Were there problems or did we deliver great service that day? It was just really hard to understand those things. And we didn't have reliable data to solve those flow problems. Our third problem is every time we ran an improvement event, our team said, I'm always looking for fill in the blank. I'm always looking for the dietitian. I'm always looking for my medical assistant. I'm always trying to find the behavioral health integration staff person. I can never find the resources I'm looking for. And the way that we captured this is called a spaghetti diagram, which is just a crude drawing of our clinic layout. And this red trace path is one patient visit. Yes, it's a wonder we have any carpet left on the floors in our clinic. So you can see this searching, this going back and around this U-shaped clinic. They were trying to find medications. They were getting immunizations ready for the patient, trying to find behavioral health integration. Providers leaving the exam room, trying to find their medical assistant because they needed point of care testing. So now take all this chaos and multiply it times 100 patients that we see in the clinic in a day for 5 providers. That is a lot of movement. It's a lot of steps. It's a lot of frustration for our team members. So we tried all different things to try to fix this. We tried radios, we tried whiteboards, we tried little pagers, we tried where I'm at boards, and we just couldn't crack the nut on this. And what it really led to was our fourth problem, which is really poorly coordinated patient visits. Patients were waiting a long time for services, people forgot them in the rooms. And our teams were frustrated because patients weren't having a great experience and they knew they wanted to deliver something better, more streamlined, but we couldn't figure out quite how to get there. So thankfully, because of our lean work, we had a really important tool that has since become the foundation of all our process analysis. And I want to just briefly walk you through that now. It really helps us see the problems in our clinics. And this is called the flow cell. You can Google it. It's out there for anybody to look at. And it just gives you a structure for how to look at processes. So the first one in the top left is simple flows. Does the work move along as intended, one by one, without big disruptions and bottlenecks? The second one is standard work. Are things done in a way that allows them to be repeatable and predictable? So do we have standards for how we do a patient intake so we capture all their quality measures? Do we have standards for how we use a flagging system? Didn't. A pull system is in the lower right corner, and a pull system means that there's a signal when people are ready for work or when work needs to happen, rather than patients are ready, we're just pushing them to the back, hope you can keep up. A pull system prevents that. Basic 6S is just a fancy way to say workplace organization. It prevents us from having defects or errors during a patient visit because people aren't searching for things or people to help with the patients. And then it sits on a foundation of visual management, which means, can I look and see a process happening and know whether it's happening normally or abnormally? And are there signals that tell me what's going on? So we did all these tests, we tried all these things, we went through all these improvement work, and we just could not figure out how to transfer this into the patient visit in a really strong and organized way. And so we were sitting around in the conference room one day, and one of our staff members says, you know, this would be a lot easier if we had X-ray vision. Like, well, yeah. But it got me to thinking about a patient flow system that I had seen years earlier at a technology conference very much like this one. And I thought, you know, maybe there is technology that can help us with this. Typically, we tend to be very conservative on technology, especially with workflows, because it sometimes just digitizes really bad process. And then you make it invisible. So processes that are visible and aren't working are now invisible because they're electronic. So sometimes it doesn't always work as well as we'd expect. But what I did is I turned this information over to our care teams, said, hey, here's a few vendors who have patient flow software. You guys dig in, see what you find. I'll give you guidance on the budget piece, or we'll look for grants, things like that, if you find something that you think will work. Care teams are the people who use this system, so I gave it to them, said, hey guys, this is up to you to research if you think it's going to make a big difference with patients. And so they did. What we decided we wanted, or what the care teams decided they wanted, was a unicorn. They wanted a lot of things. So what the team said they wanted is they wanted accurate cycle time so they could root cause problem solve. They said they wanted to decrease that patient alone time in the clinic without decreasing provider and staff time. So we didn't just want to steal time from the patient, we wanted to give them that waste time back in their day, that time when they were just alone with nothing happening. You know, they're sitting in the exam room on their phone getting really angry and really frustrated because no one's taking care of them, and you come in and they're grumpy. So funny enough, our care teams don't like that. So they also wanted something that helped care team members find each other. If I'm a provider and I only have one MA, which is how it is in our clinic, if I need something, I need it now. And if that MA is checking refrigerator temperatures or rooming another patient, I'm outside the exam room and trying to find somebody to help me. And then they wanted something that allowed team members to communicate seamlessly back and forth without disruptions to the visit. I mentioned that we had tried these two-way radios. And so we had an MA in an exam room with a little radio in her ear, and she's doing an intake on a patient, and the patient started to talk about something relevant to the visit. And she gets a little beep in her ear that says, we need a triage. We've got a patient in the waiting room with chest pain. She's like, well, do I leave the visit, or is somebody else taking care of it? I don't know. She doesn't want to respond while she's in front of the patient. So it just became very disruptive. They said, we need something better than that. And then they wanted to know whether we had enough exam rooms. I don't know if you guys have this problem, but we thought 2 exam rooms is not enough, especially when you include behavioral health integration or dietitian integration. We don't have enough exam rooms. And we thought, shoot, we need to build a new clinic. We're growing. So I thought, wow, this is going to be super challenging. But they found what worked for us. And that was a system that is sponsoring our presentation today. It's called SyncTimes. We looked at all different kinds of solutions, and SyncTimes is what fit the bill for us as far as all those things that the care teams requested. So just to orient you a little bit to what you're seeing on the screen, SyncTimes is a system that works, first of all, off badges, which you can see on the left. They're little tiny, they hide behind a typical sized, they hang in front of a typical sized badge. That has 2 little eyeballs on it. And there's receivers in our ceiling that tell you where that staff member is at. It does not track people in bathrooms. It does not track people in break rooms or once they leave the clinic. It's only in exam rooms, clinical areas, and pods. So this is really about team members being able to find each other, not about admin watching everybody's moves, which we had to head off at the beginning, I'm sure you can expect. So the first piece is the badge, which is being able to locate team members. The second is, you can see in the top picture here, that's a tablet outside the exam room. It has little lighted bars on each side, has color coded based on what's happening in the room or what's needed in the room. It's got a picture of who the room's assigned to that day, which is what you're seeing there. And then the bottom is basically a duplicate, and that's on the inside of the exam room. So if the provider says, oh, shoot, I need to update this kiddo's immunizations, and I want to get a point of care strep test, the provider can select those icons from inside the exam room. They don't have to go find anybody. And then in our air traffic control area, or our flow station, which is here on the top right, in each pod, it alerts to what that provider is asking for in the exam room. So if they need a medical assistant to come join them, they need behavioral health, they need translation, if they need a care coordinator to come, they don't have to leave the patient in the exam room. The patient is paying for FaceTime with the provider. So as soon as those services are taken care of, the icons are cleared off, the patient can leave, and we get beautiful cycle times. People can find the resources they need. They know if someone's not available because they're in an exam room with another patient. So it's really nice. It gives visibility down the hallways, and it really takes those walls down so we can see if the provider needs something, if somebody's starting to run behind, and what can we do to help, rather than just walking down the hallway and there's a bunch of closed exam room doors and, you know, I'm supposed to know what's going on, but it seems like everything's fine. So this is really helpful for our care teams to know situationally what's going on in the whole clinic, and not just the clinic they're in, but also our outlying sites can also see what's happening at the main clinic and vice versa. So if one of our PAs out in Glens Ferry needs a consult with our internal medicine doc because he's got a complicated patient in front of us, he can say, oh, Dr. Ajazi is available right now. I'm going to call him and see if he can help me out. Or he can shoot him a message and say, hey, when you get out of your next patient visit, can you give me a call back? All without ever picking up the phone and dialing and trying to find people. So speaking of exam rooms, I thought maybe we'd have a look and see what's actually happening in the clinic here. Would you mind? That will, as long as we're here, we'll just see what's happening. Not super busy today, but I'm standing here with you guys. I'm 1,000 miles away from my clinic, and I can tell you exactly what's going on here. So in exam room 2, there's a patient in there. The patient's been in that exam room for 20 minutes, and Dr. Ajazi is in there now. That's the little picture of him in the lower left. And he's been in there with that patient for 3 minutes. I know that Dr. Ajazi's visits run about 15 minutes. So if I need him as his MA, or another provider who needs to consult with him, I know he's going to be about 12 minutes before he's done with that visit. We've also got in exam 4, Genevieve, our nurse practitioner, and oh, she just left and went out to go take care of a patient in a car. Her and Naylene are working in our car clinic. So we aren't rooming patients like we would be, but I can tell you that Genevieve just walked out the door to take care of a patient because she left that exam room. In the phone room down here at the bottom center, Lorena is in there. She's our triage nurse, so she's hanging out in there today. And then if I needed behavioral health integration, this is Dr. Deb, and she's hanging out in Team Pod 4 today. So if I have a patient who's in crisis or who just needs a little help, say, oh, Dr. Deb is available in Pod 4. I can run and grab her right now while she's free. Or maybe she's in an exam room with another patient, and I say, I need to put in a referral, or send Dr. Deb a message and let her know to call back this patient who's in crisis and wants to talk with her. So I just pulled up our current exam rooms. There's other clinics that you can put on the display, but it gets really tiny. So the last thing I want to point out is in the lower left corner, it shows how many visits have been finished by each provider today. They're about halfway through their clinic day. So Dr. Ajazi's seen about 8. Dr. Gray's seen 5. And then it also shows us next to that our cycle times. So the red is alone time, The blue is provider time, and the green is staff time. So I know our cycle times today, standing here with you, within about 30 seconds of opening this window. So just think for a second about how this type of transparency is a complete shift from how we normally do business. You know, normally everything's happening, we expect people just to ask if they need help, or we expect that we can look at the data later and kind of maybe see what was going on. But this for us was real-time opportunity for improving the patient experience and allowing our care teams to find resources that they used to spend literally hours of their day searching for when we walked behind them and said, okay, what are you doing right now? I'm trying to find the behavioral health integration person. The other unexpected benefit of this, when we first started our patient registration team, we weren't really sure if they were gonna need it or want it, but we thought, well, we'll just give them logins, see what they think. So 2 days after we launched, I went to the patient registration team and said, hey, what do you guys think? Are you using it? They said, this is the most amazing thing in the world. Because it used to be that when a patient would call the clinic, hey, can I speak to Dr. Ajazi's nurse? She called me about my lab results. Sure, hang on a second. Extension 257, nothing. Extension 258, nothing. Extension 259, and we get these call loops going on in the clinic with someone who's on the phone with the patient who needs our help right now, not wanting to take a message and pass along work. Instead, now they can say, you know what, Julie just went into a patient room. She'll call you back as soon as she gets out. She's going to be about 15 minutes. Would you be willing to hang on while she finishes her patient visit? So just think about the speed of communication and patient care when you have that level of insight into your clinic operations. So certainly an unintended consequence that we sure loved was our patient registration team said, we cannot live without this. It just makes communication so much better. So this isn't an insignificant change to implement. As you know, most technology is not plug and play. And we've had some real failures with technology. Oh, sorry, yeah, we need to switch back over. There. So we did this a little different because now we had lean tools, lean knowledge, and a lean culture. And so what we said is before we ever put this technology out in the clinic for people to use, we're going to define our standards because we knew that standard use of flags and technology was getting in our way. So we asked the Sync Times team, would you guys please just humor us and spend a day process mapping with us? Would you be willing to just walk through, we're going to map it out, we're going to test it, we're going to tweak, we're going to come back, we're going to do it in a day, but would you walk through this process with us because we're new to the technology and we don't know all the things it does. So the two white shirts in here, that's Andrew and Alan. Alan's actually the CEO of Sync Times. Sat in our conference room with us for 8 hours and process mapped, and they walked back into the clinic with us and tested. And we developed these standards that we were able to hand over to our staff the next day when we did really brief training, so that once the training was over, they knew exactly what to expect, and if they had questions, they had a resource. So here in the middle, that's just our icon key. So if someone said, hey, what was the little circle with the two people? Was that care coordination or behavioral health integration? And so we just matched the instrument. This is a full patient visit, start to finish, with everything a patient might need, immunizations, imaging, labs, and we put the icons on the far right. So the details probably more than you need to know, but what we really focused on was creating a standard way to use the system, and that way there weren't questions. And if people were on vacation for a week and came back and they had questions, we had a resource for them. So we had this relatively quick go live because we spent one day doing this. The next morning we started training, and by about 2 o'clock in the afternoon, the whole clinic was live with the system. Training took about 15 minutes in the morning, so not very long. We walked them through the standard work. We let them test the patient visit, selecting icons, clearing icons, asking questions, and then they were basically ready to roll. So we had some really early wins that really excited the staff that I wanted to share with you. This is Dawn in the white coat. She is a nurse practitioner. We call her Dr. Dawn because she's got her Doctor of Nursing practice. And this is Griselda. She's our lab tech. She calls herself the BLT, the beautiful lab tech. And Dawn was about an hour into using sync times, I think, and she was with a patient that she decided she wanted to draw labs on. So she selected the lab icon and then the checkout icon, which means I don't need to see the patient again. As soon as their labs are drawn, you can take them to checkout. So Dawn finishes up with the patient, and she's getting ready to leave the room, and she opens the door, and Griselda is standing there with her little lab bucket. It's just super excited to be able to respond to a patient need and know where she was needed and when, rather than, hey, Griselda, I think Dawn's looking for you. I don't know what she needs, but she's asking about you. So just, and think about that from the patient perspective. You're sitting in the exam room going, oh, I gotta get labs drawn. I'm gonna have to go to the lab. I'm gonna have to wait. Nope, you need labs. Here's the lab tech right in front of you. Just beautifully coordinated, not chaotic, really streamlined, very respectful of patient and staff time. And that was so exciting for our teams to see on day one. And now that's the norm. That's how we do things. That's how our patient visits flow. Certainly not 100% of the time. We still have limited resources. We have one behavioral health integration person, one dietitian, one lab tech, and they can't be all places at all times. But at least they know the sequence of where they need to be and who needs them. So very exciting stuff. And speaking of results, you guys probably want to know, so show me the data. I said we get good results as an organization, and we really focus on having good data and proving our improvement work. So just from this perspective of strategic decision making, the care team said, we're out of exam rooms. You guys got to help us out here. And one of the things that Think Times has really helped us with is understanding exam room utilization. So the more teal this chart is, the more time that exam room is used. And this factors in a lot of things. You see a lot of red on here. Some of that's after hours. Some of it's we only have one provider in clinic. We have a ton of people on vacation right now. So these numbers might be a little lower than you would expect from someone who's complaining about not having enough exam rooms. But really this helped us realize that we had unused areas that we could use as exam rooms if we needed to pull a patient for a behavioral health integration session or a nutrition session. So now we've changed our process based on this data, and we identify at the beginning of the day what our overflow rooms are. Procedure room can be used. We have a behavioral health consult room that can be used as an exam room. And so we have these spaces where if we need to get a patient out of a room to keep our flow going, those are announced at the beginning of the day. They're written on our huddle board and everybody knows what those rooms are, rather than, well, I just got assigned rooms 3 and 4 and those are my rooms for the day and good luck. So we've really been able to change what we're doing and allow better use of our resources because of the data that we're able to get from the system. And speaking of dietitians and behavioral health, this is another area that we look at quite a bit. And what this is telling us is how many times were each of these icons selected during any given time frame. This is the past 30 days for us. So one of the areas that we're worried are being underutilized are behavioral health integration and our dietitian, which are up here, the first 2 areas. And based on 30 days of data, about 20 working days in a month, we can see that behavioral health integration is being requested about 3 times a day. That's for 5 providers, so that's not a lot. And our dietitians being requested about half that often. So this doesn't take into account the fact that they have regularly scheduled long education visits. But what this told us is we suspected the resources were underutilized. Now we know they're underutilized. And so we're working on some improvement projects to increase communication, to make sure that we have enough resources available in any given clinic, to make sure that if a provider says, hey, I've got someone in crisis, I really need you, that we can have workflows to support that. The other thing it tells us is who's actually clicking these icons. This is, like which providers are actually using behavioral health integration? Which ones do we need to go to and say, hey, did you know behavioral health integration isn't just for crisis? They can help with sleep hygiene, medication adherence, healthy eating, all these things, and help that provider understand how behavioral health integration can help them keep their patient flow going. So just really, really for us, very powerful data. But I think for us, probably the most important is the patient experience in the exam room. And this is what we set out to tackle when we had that alone time with the patient. So what you're seeing here on the chart is all of our results since we started using the system last June. Yes, we did launch in the middle of COVID, which was probably crazy, but I told you that we do things sometimes a little differently than others. So we took a big risk and we got a huge reward. So when we started, first bar on the left, our average patient alone time in the exam room, unattended, getting no services, hanging out, looking at their clock, getting angry, 17 minutes. The green bar is time with support staff. So that would be typically a medical assistant or an LPN, was about 6 minutes for the intake. And then they were getting 16 minutes with the provider, sometimes 17 in that first month. And so we said, we gotta protect that. What we wanna do is eliminate the waste, get the red out, and make sure that we're not stealing time from staff. So where we are just as of last month, you can see that our exam room time for the medical assistants is exactly the same. And our time with the provider is exactly the same. So the patient's having the exact same experience as far as the care being provided, but they're spending 6 fewer minutes alone in that exam room with kids that are fussy, with jobs that they have to get back to, with things that they're worried about, errands they have to run. And so to me, this is giving people 6 minutes back in their day. You multiply that by 100 patients a day, you've given a lot of time back to your community. And so that was really probably the most compelling thing for us. Little scroll problem here. But the patients are really who are telling us about the results we're getting. So the blue line on here on the chart is that alone time that you just saw on the chart before. The orange line is our patient satisfaction scores over the same period of time. So, and also, just so you know why the graph cuts off, we fired our patient satisfaction vendor back in July. We're just now starting with a new one, so that's why I don't have data coming into the summer, but just really powerful information for us and confirmed our suspicion that if we give people back time in their day and give them a beautifully coordinated patient visit, that they're gonna be much happier with the services they receive. And sure enough, that's the story they told us. We had a couple keys to success that I want to share with you guys. So the first thing that I mentioned was just the planning. I think sometimes, you know, there's this health center saying of, I don't know if it's health center saying, but I hear it all the time of ready, fire, aim. And we fix everything after we hurry up and get it in place. And we spend all this time with rework loops and trying to make corrections. So that time up front with planning and creating standards for how the system was used, even though it was brand new to us, was just really vital to making sure that the staff had a great experience and were able to use that system in a way that was really helpful for them. Second one for us was a super strong partnership with Think Time. They just literally bent over backwards for us. Like I said, the CEO was on site with us for process mapping day. Our medical clinic manager texts him frequently. Things go wrong, which is probably will have to change over time, but you know, Patty has Alan's cell phone number and they communicate when they need to. So just really, really powerful partnership that helped us be successful. Having a clinical champion might have been the link in the chain that was that helped us the most. And our medical clinic manager, Patty Hernandez, said, if this is gonna help my team and this is gonna help our patients, I'm gonna own the success of this project. And so Patty took it upon herself to become an expert in that standard work. She helped write it and develop it. She helped roll it out to her team. And so anytime something was going wrong in training, things go wrong in training, Patty said, hey, I'm gonna jump in and help. It doesn't matter what else is happening right now. The most important place for me is to be with my team, helping them figure out how to use the system in a way that helps them serve patients better. And the last thing is just that ongoing coaching. We had that really intensive coaching by Patty for 2 to 3 weeks up front. But even today, a year later, if she sees something on the screen and goes, I'm not really sure what's happening in there, she gets up from her desk and she goes and finds out. And if we have a new staff member, sometimes people forget their badges. We track all those issues, and Patty takes it upon herself to make sure that those are addressed so that everything is running as it should be and nobody's surprised when they see something happening on the screen. But one of the most important concepts of lean is the people who do the work have the most knowledge of the system. And so I just wanted to share with you guys a little bit of feedback from our teams. So like I mentioned, patient registration, just blissful. So excited that they don't have to make 15 phone calls to try to find somebody. Our medical assistant said it saves time knowing when to check on patients. We have a much better routine. It has gotten me into a better routine at work. So she's now creating those repeatable, predictable outcomes and visits for patients. And then our provider said it really just saves time looking for those resources that she needs during a patient visit. It improves that flow, and it just saves so much time. And then, of course, our CEO, who likes the data, loves being able to see this and understand how it's impacting the patient experience. And also, as we do plan for a new clinic, what does that utilization of exam rooms look like so we can make a really educated decision about what we need? So the theme here, as you can see, is time. We're giving people time back, and that is, there's nothing more valuable for us to give them. Whether it's our care teams or our patients, giving back time is an immense gift, and all of us as leaders should really be working on giving that time back to people. So what's next for us is we focus on continuous improvement. That's one of our 2 core values as an organization. So things that we're looking at is rolling this out to our dental team, which doesn't work behind closed doors, but we have them separated in 2 different wings, and they often need to help each other out. We recently installed bathroom pull cords that are integrated into the sync time system. We had some patients falling in bathrooms and couldn't let us know. And so we got pull cords that now flash that a nurse is needed in a bathroom area so that patients aren't laying in there. For me, as a person who has a quality and risk background, super important that we have something that's reliable and we believe in. I think the last thing that I would want to share on the continuous improvement front is this idea of cycle times. We can never take enough waste out of our process. We can never give enough time back to patients and staff. And so looking at our clinic, looking at our flow times, looking at our data and saying, hey, where can we just get a couple more minutes back, and then multiply that by 100 visits a day, and the impact is just immense. So my question is, what's next for you? And my challenge to you is to think about your care teams today, and think about sometimes the chaotic environments that we're working in, not because people want to work in chaos, but that's just how healthcare is designed in some ways. And there's enough chaos in the world right now. There just really is. And I believe that when people go to work and their workplace is chaotic, their tolerance for chaos outside the workplace is diminished. And there's no scientific studies on that I've read. It's just my personal belief. But if we really want to be respectful of people, if we really want to focus on continuous improvement, my challenge to you is to find one thing you can do when you get back. Whether that's drawing out a spaghetti diagram with your teams, testing out something that you hadn't thought of before, even just going out and asking people, what gets in the way of really good patient flow? What are you always searching for? What's always broken? Your staff members will tell you what they need to be fixed that will make an immense difference, even if it's something really small. So please today, just think about going back and doing one thing that will help your care teams have a better experience and deliver a better experience to your patients. Thank you. And I have time for questions.
Excellent presentation.
Thank you.
A couple of questions.
I'll do my best.
Is 2021.
Okay.
Based on the experience that we have in the nanotechnology association, how did you deal with negative Net?
With the sync time system, you know, we didn't have much of that. What I will tell you is a huge mistake that I made, and I make a lot of them. So this is just one. But when we launched the system, we had really good communication with our medical teams. We prepared them for it. The team who selected the software talked with their colleagues about what was going on. We didn't share that information with the dental team. And so the day after we went live with the system, I get a message from a dental staff member that says, hey, we heard that you're tracking employees with these white things in the ceiling. How come we weren't told about this? And I said, oh my goodness, okay, I missed the boat on that one. So we had some employees, because I didn't communicate with all staff members impacted, that thought that we were tracking employees in the clinic. And so we brought them over, we showed them the badges, we showed them that the receivers were only in clinical areas, that it was just for care team members to be able to find each other. And that really brought down some of that suspicion about tracking and logging. And I mean, they know how it works. If their badge battery dies, nobody knows where they are. So it's not like we can see them outside the building or in private areas. Cost per visit, I actually don't know. I could find out, but I didn't think to think about it that way in the past, but I really like that. I'd love to know that myself. So, but I can also get you connected with the Sync Times team, and they can help you out with that.
We can definitely, follow up with John after in regards to that.
Mm-hmm.
Do you have a question? I have a question too.
Go ahead.
Oh, great.
Mhm.
The only question I have is, what does it not do that you wish it would?
Oh, what does it not do that we wish it would? Yeah. Boy, we've sure added a lot of things to it that we thought, man, we wish it could X. And we talk with the team and they go, oh, yeah, bathroom pull cords. Setting timers. If we have a patient who's sitting in a room waiting 15 minutes for a COVID test, we've got a timer function that tells us when that patient's done. You can see it from anywhere in the clinic because it's up on the air traffic control. One thing that we've batted back and forth is whether or not we should do an EHR integration so that we know when patients have checked in. But we have decided, the care teams have decided as a team, that we don't really need that and it might add more complexity. We really love the simplicity and it's very simple and easy to use, and the more we add to it, the more we take away from that simplicity and ease of use. So we've said for now, we're not gonna work with the EHR integration piece. For a while, we were wishing there was some dental capability. Now there's dental capability. So we haven't really found much, but I'm sure I could think of something given enough time. Yeah.
All right, Robert, do you want to bring that up? So this seems like a no-brainer to implement the sync time system, but was financial cost a barrier to implementing in other clinics?
Yeah, that's such a good question. I think all of us know how cost-sensitive health centers are. We knew, because of the data that we were tracking, that we would know in very short order whether or not we were getting a return on investment from our dollars, and I shared some of that data with you. The other thing that we did was we grant funded a fairly good chunk of this through our primary care association's health center controlled network technology dollars. We're working right now on getting an oral health integration grant to roll this out into the dental team, because we want medical and dental to be connecting with each other. Even though there's only a frosted glass door between them, it's like it's a concrete wall. And they need each other. And so oral health integration dollars was one place that we went for this. HRSA quality improvement dollars. And that sounds like a lot of grants, like, oh, it must be super expensive, but we just pieced together small bits of funding that made sense to implement this for us. So this did not come out of general fund dollars for us. It was all grant funded.
How much time was spent up front on transforming that culture like the lean culture? And did you do it by
Mhm.
group, or did you do it in one kind of big bang approach?
We're 4 years in and we're still doing that. So the two cultural principles we have around lean are respect for people and continuous improvement. And if you can find an organizational value that doesn't fit into one of those two buckets, please let me know, because I have not found one yet. But it really is a culture shift that takes a long time. You're getting people to get comfortable with standards. Not that you're trying to standardize the way a doctor sees a patient, but really creating those repeatable, predictable outcomes, getting people comfortable with raising their voice when something's wrong, problem solving in the clinic environment where it maybe used to be a little threatening to say, hey, my stuff's broken and I don't want to be a squeaky wheel, but I can't take care of patients. Getting people to speak out when there's issues so we can problem solve quickly, that's taken time. So we're 4 years in. I'd say we're much stronger culture-wise than we used to be, but we certainly have work to go.
Last question, and then we'll go.
No, my,
Okay.
Just thinking about your patient experience, did you change the way you provided your survey after implementation, or did you continue with the same survey?
We continued with the same, yeah. And what the score was that I showed you was actually our Net Promoter Score. If you guys are familiar with that, it's on a scale of -100 to +100, with people who rate you, I think it's 5 or less, being people who are probably not saying great things about you in the community. People who are in that 6, 7 range, being pretty neutral and not really counting toward your score. And then people who are in that 8, 9, 10 range on a question, would you refer us to family and friends? Or would you recommend us to family and friends? Those are the people who bring your scores up because they're promoting you in the community. So we were tracking that before we ever started with Sync Times, and we were in that kind of 78, 80-ish range. And then most recently, we've been almost pushing 90, which is almost unheard of in healthcare organizations. So we do have amazing patients. So I'm not going to say that that's, that's certainly true of 100% of patient experience. But yeah, it's been consistent months before we had Sync Times. And then today, we're just getting switched over to that new vendor to get the same data.
all right, my question is, with staff turnover. So we are having the conversation nationally. I think that when you and I talked when we were discussing the presentation,
Yeah.
how we have a shortage, people are leaving the healthcare, there's a trust issue in regards to the vaccine and, the mandatory vaccine and all of that. So, have you guys seen any, staff turnover, and then how these help or not, in regards to that?
Yeah, we're very fortunate. We don't have a ton of staff turnover in clinical positions. Patient registration team, we do have a fair bit, entry-level position. It's a challenging job, especially right now. Oh my gosh, the amazing ladies that we have in our registration team are phenomenal for what they sometimes put up with on a daily basis. But what we've seen is a difference in our team's relationships with each other, is how I would put it. And their relationships with their leadership team. Because now, rather than we have to keep our mouth shut, we're just going to create workarounds for issues because it's easier than saying something and either being disciplined or, I bring it up and it never gets fixed. Part of our lean transformation has been about creating a voice for people and respecting when they bring an issue that impacts their ability to take care of patients. The conversation has changed now in that people bring great ideas and they bring problems, which I love, because if we don't know about them, we can't fix them. And so I would say that the staff is more creative, more innovative, loving to solve problems, and really being vocal when something's impacting patients, which to me is the most important.